can you kind of give an idea of dosing protocol? Is it 5 milligrams or is it 150 milligrams? Where are we looking at? Or is it, again, I know it's different for everyone. And also staying ahead, like in a pain patient, on a scale of 1 to 10, they're at a 10, but when they take cannabis or the opioids, they're down to a 2. Don't wait until you're at a 10 again before you take it. And so a lot of doctors will say, hey, before you get to that pain threshold, let's stay ahead of the pain. And the same thing what I'm seeing with autistic children is keeping it in the system, not so they're drugged out all day, but keeping it and knowing, like you said, your daughter. A mother or father should know their child and what they're going through, and saying, oh, we're seeing this reaction, or we're seeing how their personality is changing here. I can see this is about to come on, every day at 2:00, I'm running the same thing. And so do you recommend, or do you do this with your daughter, where you stay ahead of before the breakdown happens?
Absolutely. Absolutely. And I teach that once you figure out what works for your child and works for, what triggers those huge behaviors in them, then you can act preventatively. And as soon as you start seeing signs that there's disease, or that they're discontent and they're starting to show signs of agitation, you can treat early on and often prevent that huge exacerbation. And, just to give you a little bit of perspective on that, at height of my daughter's puberty crisis, she was melting down and tantruming, full tilt tantrum. She would go for 2 or 3 hours, and she would literally exhaust herself physically and pass out at the end. So, this is what we're trying to prevent. Nowadays, if she gets upset, usually we can prevent the meltdown completely. Usually, we can have her feeling better in maximum of 10 or 15 minutes if we go with sublingual. She's learning to self-soothe. She's learning to self-comfort. She'll actually give herself a timeout in her room when she's not handling things well. So it gives our kids, because our kids don't feel good about their behaviors either. A lot of times they show remorse after the fact, and they feel badly. So we're giving them really important tools to self-manage at the same time that we're medicating and helping to target some of the underlying causes of their behaviors. So it's such a wonderful tool that way.
Hi, John Malanca here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at UPatientsGroup and on Facebook at United Patients Group, as well as for our podcast. Please click the link in the description below. We'll see you there. Bye-bye.